Hey, I'm Jordan, and I'm here to help guide you step by step through Missouri's Medicaid application process. Missouri's Medicaid program provides quality health insurance for children and parents, seniors, pregnant women, and people with disabilities. In August 2020, Missourians voted to expand eligibility for Medicaid. Now, adults ages 19 through 64 are eligible if you are single and make up to $17,774 a year, or a working family of four making up to $36,750 a year. If you are eligible and don't have health insurance, you should apply for Medicaid. It covers primary and preventative care, outpatient care, emergency room services, medication, and allows you to get your eyes and teeth checked. Before starting the application, we recommend having the following documents or information on hand: Social Security number, or documents showing your immigration status, like a green card, income information like pay stubs or last year's tax information if you're self-employed, and any medical insurance information. You will need this information for anyone you file taxes with or claim on your household taxes. If you have applied for Medicaid before, but never heard back, we suggest checking your application status before applying again. Go to the Missouri Department of Social Services website at mydss.mo.gov and click Check My Status. If after entering your information your screen reads No information available, most likely your application has not been approved or processed yet. However, if your screen shows active coverage with the start date listed, then you have likely been approved for Medicaid and do not need to apply. We also suggest checking your eligibility for Medicaid before applying. To review who is eligible for Medicaid and whether you should qualify, you may visit mydss.mo.gov/healthcare/apply. Note that if you qualify for Medicare Part A or Part B, you will not qualify under Medicaid expansion. Now, let's get started. The application will take about 30 minutes to complete. You can stop, save what you have done, and come back later, but we recommend you finish in one sitting. Go to mydss.mo.gov. Click Apply for Health Benefits. The next screen will show a disclaimer. The disclaimer gives legal details about providing your personal identifiable information, or PII. Review this page. If you have questions, contact your family support specialist or the Missouri Department of Social Services. After reviewing this page, click Next. If this is your first time filling out the Medicaid application online, or if you've forgotten your login information, you will need to create an account. If you have submitted other applications, it is best to log in using your username and password. If you do not have this information, you can create a new account. Since this is my first time applying, I'm going to create an account and take you step by step through the application process. To create an account, enter your first and last name. Email is optional. Then create a username and password you will remember. For the username, I'll use Jodo123. Now, your password must be 8 characters long with at least one number or special character. Be sure to also set up your password hint. Write down your username and password somewhere safe so you can log into your account again when needed. Once that's complete, check the box to indicate you've read and agreed to the terms and conditions. To learn more about the terms and conditions, you can click the hyperlink below the checkbox. Then hit Next. The next screen is optional. You are not required to verify your identity. We suggest bypassing this screen as not to delay or lengthen your application process. To bypass this screen, click on the house at the top of the page, toward the right, next to Welcome and your name. Skipping the verification page by clicking the house at the top of the page will take you to the home screen. Once here, look at the menu bar on the left side of the page. Click Applications. You'll be taken to the My Application screen. Next, click Apply for Health Benefits. This sends us to the Getting Started page. Start your Medicaid application by indicating for whom you're completing this application. I'm applying for myself and my daughter Macy. Indicate whether a certified counselor is helping you complete the application. Then click Next. Check the box to indicate you have consent to apply for all persons on the application. The drop-down asks for how long you would like the government to keep information available, such as this application, to renew your benefits in the future. We recommend selecting 5 additional years. This means you may not need to apply for health benefits again for 5 years, unless there have been updates to your personal information. For the next section, you'll need personal information, social security number or immigration status information, mailing address, and contact information. This information will be needed for everyone included on the application. Just as the section says, on this page you'll need to provide information about yourself. If you have the same name as someone else in your family, be sure to enter your suffix, like junior or senior. Regarding gender, the state of Missouri only provides 2 options, male or female. Select the option that is listed on your driver's license or birth certificate, even if it is not how you identify. Next, you will need to enter your home address. Since Medicaid expansion is only for Missouri residents, this will help determine your eligibility to receive benefits. If you do not have a home address, indicate your state, county, and if you have a mailing address. A mailing address will be needed as communications are sent via mail. If you have a home address, enter the information in the fields and indicate whether it is also your mailing address. If not, also provide your mailing address. Entering additional contact information is optional. Next, indicate if you are applying for benefits for yourself. Later, you will be able to add additional household members to the application. You will also need to indicate whether you want to apply for coverage for the past few months. If you have acquired medical bills during the past 90 days, you can click yes to this question. I have not had any medical bills, so I'm clicking no. An address validation page will appear to confirm your address. If correct, we recommend selecting the Code 1 Plus Recommended Address option. In the More About You section, you will provide information on your race, ethnicity, citizenship, marital, and veteran status. If you are a certified American Indian or Alaskan Native, click yes. Keep in mind you must be a card-carrying member of a tribe to select yes. Next, select the options that best describe your ethnicity and race. Aside from the first question regarding being a certified American Indian or Alaskan Native, you may choose not to answer if you don't feel comfortable doing so, by selecting I prefer not to answer at this time. The questions about marital and veteran status are also optional. Next, you will need to indicate whether you have a social security number. If you do not, or don't know your social security number, select no. Then, indicate if you have applied for a social security number and answer the follow-up questions. I have noticed that using a green card and entering your alien number can freeze the system. If you have a green card, we suggest submitting a paper application to make sure your application is properly processed. If you have a social security number and know the number, enter it. Then indicate whether you are a citizen by birth. If you are not, an additional question will follow. Next, indicate whether you are or will be eligible for Medicare Part A or Part B. Remember, if you are eligible for either one, you will not qualify for Medicaid expansion. Select your marital and veteran status, if you'd like to fill these out, then go to the next page. In the next section, you will provide information about the people in your household. If you are in the household or file taxes by yourself, then this section may be short. This section begins by asking if there is anyone else in your household. This means anyone who lives in the same house as you, anyone you expect to include on your next tax return. If there is a tax dependent over 18 years old being claimed by their parent, the parent must be included in the household. I live and care for my daughter, Macy. so I will select yes. Next, you will need to provide information for the people living in your household. Depending on your responses, there may be follow-up questions. If people in your household are also applying for coverage, select yes. For the question, do you want to apply for health benefits for this person? Since I am also applying for Medicaid for my daughter Macy, I will select yes. I also want coverage for Macy for the past month. So for the highlighted question about retroactive coverage, I will select yes. Then, select the person's preferred language and go to the next page. Like you did for yourself, you will need to provide the information on your household member's race, ethnicity, citizenship, marital, and veteran status. If you are a female, regardless of age, the system will ask if you are or were recently pregnant. Once you have provided the information for each of your household members, go to the next page. On the More People page, you will be able to see everyone you have added to your household, their date of birth, if they're applying for benefits, and if they would like retroactive coverage. If you have additional people to add, select yes from the drop-down. Otherwise, select no and go to the next page. On the Relationships page, you will need to indicate your relationship to your household members. Since I am Macy's dad, I'll select is the parent of. To read, Jordan is the parent of Macy. If you're not the parent and are the primary caretaker for the person, indicate so in the drop-down. Then, click Next. On the Tax Filer Information page, indicate who in the household will file taxes in the next year. This is important because it affects your eligibility for health benefits. If you have potential tax dependents, you will see the Tax Dependent Information page. Here, indicate who will file the dependent on their taxes. Depending on your response, more information may be needed. Since I plan to file Macy as a dependent on my taxes, I will select yes and indicate I will be the one to claim her. Next, you will see Household Summary. Use this page to ensure you have entered the correct information for each individual listed. If anything needs to be updated, click Change to make edits. After you have double-checked the information, go to the next page. Earlier in the application, I indicated that I also wanted to apply for health coverage for last month for Macy. I will provide more information about this on the prior quarter medical bill information page. If you do not want retroactive coverage, you can skip this screen. If you do, first, confirm the individual is applying for retroactive benefits. Then, indicate for which months the individual needs coverage, received medical bills, and was a Missouri resident. To receive retroactive benefits, all three boxes in the row should be checked. For instance, I've checked all three February boxes for Macy. If Macy hadn't lived in Missouri in February, then she would not qualify for benefits during that time. However, she did, so I will keep that box checked. If you're seeking health benefits to cover prior months, you will also need to indicate if you received income and for which months. You will need to provide prior month's income information for any individual seeking retroactive coverage. The next screen will show a summary of the prior quarter's information you provided. Use this page to ensure you have entered the correct information. If you need to update any information, click Change under the Action column. Once you have double-checked the information, go to the next page. Next, you will need to provide details about your household income. To complete this section, you may need tax returns, pay stubs, and other details of income for anyone in your household. For each individual, you must indicate if they have any income. Next, enter the details of income. Indicate the type of income received and accompanying information. the amount you make and how often, or the frequency you're paid that amount, and the start date of you receiving that income. If you still receive this type of income, then do not indicate an end date. Indicate whether you have additional income. If yes, you will be given more space to provide details on that income. On the Income Deductions and Expenses page, indicate whether the individuals pay for items that can be deducted from their taxes. These could be things like student loan interest paid or contributions to a retirement account, such as an IRA or 401k. Since I have no tax deductions, I'll select No. The next page will ask you to confirm your annual income. Your annual income will be the sum of all the income you provided in the previous section. If it looks correct, move on to the next page. If not, go back and check your income information and frequency of pay. The application will ask for income for everyone in the household. Since my daughter Macy has no income, I'll select No. On the Additional Information for Missouri HealthNet screen, you can indicate if anyone in your household is in jail. If no one is in jail, click Next. The next screen will ask about other insurance coverage household members may have. Indicate who has coverage through an employer or private health insurance. It is possible for someone to have more than one health coverage at the same time, but Medicaid will always pay last. If you indicated earlier that someone in your household is or was recently pregnant, you will see the Pregnancy Self-Attestation screen with a couple of questions. Otherwise, the next screen will again ask if you have health coverage through an employer. Indicate the individuals who have coverage. Then go to the next page. On the Additional Information for All Applicants screen, you will be asked if anyone applying for benefits is blind, disabled, or has physical, mental, or emotional health conditions. Select the appropriate answers for your household members and move forward. Next, you will need to confirm the head of household. If you are in the household alone, select yourself. Otherwise, choose the primary contact for the household. On the summary page, you can review all the information you provided in the application. This is your last opportunity to make changes. Once you go past this page, you cannot go back. Take your time to double check the information. Once you are sure all your information is correct, go to the next page. You have made it to the end of the application. You are now ready to sign and submit. After you sign and submit, this screen will appear. If you mark that you have a disability, an additional form will need to be submitted after this application. If so, click Supplemental Form on the screen, which should take you to an additional form. I do not have a disability, so I will not submit the supplemental form. Therefore, my application is complete. We did it. We applied for Medicaid. Applications typically take between 30 and 45 days to be processed. If you mark that you have a disability, getting a decision can take up to 90 days. However, right now, sometimes things are taking a little longer. If you do not have a disability, but you don't hear back from the state after 45 days, you can contact your local legal services office to see if they can assist with checking in on your application. Check your mail in the next few weeks for a letter. You can also check your status online at apps.dss.mo.gov/benefit review/benefit summary.aspx. You have taken a powerful step forward in taking care of your health. Congratulations!